Welcome to Healthcare for Better Living, a program devoted to promoting good health in our community.
How do you feel? Before you say fine, ask yourself again. Few people want to talk about mental illness, and even fewer want to acknowledge it. As we grow older, we learn that it is important not only to take better care of our body, but also our mind and spirit. However, that can be quite a task as we encounter the many challenges life has to offer from day to day. There was a time when the everyday sight of groceries moving along a checkout line was more than Anna Habedank could bear.
I had panic attacks when I went to the grocery store.
Stepping into a crowded room was out of the question.
I couldn't go to a restaurant. I never went to very many of the other stores to do anything.
Either of those situations or any of a dozen others caused Anna to have panic attacks.
Because before a panic attack come on, you just get faint all over like.
Panic attacks limited Anna's activities for nearly 5 years.
And down I would go.
A registered nurse suggested she might get help at Lake Region Healthcare Bridgeway unit.
Barb Miller came from the psychiatric unit.
Barb is a nurse at Bridgeway with over 20 years experience in specialty geriatrics. One way that elderly in this area can get treatment is through Lake Region Healthcare's Bridgeway unit. Its older adult program is designed to improve the health and quality of life of older adults whose mental health issues are often complicated by medical and social factors.
She told me that it wouldn't hurt me at all to go and find out to see if I could get help.
Like many older adults, Anna was at first reluctant to seek help for her mental illness.
After she was there, come the second day, I made up my mind myself, from what they had told me, of course, because I'd never heard of the place before, and agreed to go.
There is a place to get help. Bridgeway, a short-term care facility attached to Lake Region Hospital in Fergus Falls, specializes in helping people overcome mental illnesses.
They wanted me to make sure that I knew I was going to get help. But anyhow, the first 3 days I had panic attacks right there.
Physicians and other caregivers at Bridgeway helped Anna get the right medication for her panic attacks and helped her understand her illness.
You go to Bridgeway, they're all so good, so generous, so kind. I wasn't one bit afraid. I think I enjoyed it because I thought, I'm going to get better, I'm going to get better. And so I enjoyed it and knew that they would do something good for me. We made cookies one day.
Bridgeway offers a unique, positive, home-like atmosphere. All rooms are private. Patients share a kitchen, group rooms, and quiet activity.
We did what we wanted to. If we wanted to read, we read. If we wanted to do craft work, we could do craft work. And we could visit with the other residents.
Bridgeway believes that a smaller home-like setting allows the staff to better meet the individual needs of their patients.
I liked my doctor, Dr. Trazer. He knew what I needed.
Dr. Daniel Trazer is a psychiatrist on the staff of Lake Region Healthcare. He, along with Dr. Katz and Dr. Harris, have experience helping older patients and know that their needs are often different than those of younger people.
They changed my medication. It did the trick. It was a miracle.
Within a week, the difference in Anna's life was night and day.
The doctors and nurses and even the residents, we encouraged one another. And you will get better. In 3 days, I was better. They knew what I needed.
Gone was the fear of leaving her home in the country near Detroit Lakes.
No more panic attacks. I can go to the grocery store. I can go to the restaurant. I can go shopping. I can go to assemblies with large groups of people. Well, I have never had another panic attack since I left Bridgeway.
Treatment at Bridgeway is high-touch medicine that focuses on the person as an individual. Modern medicines allow physicians to better treat certain conditions than even 5 years ago. Building trust, education about their illnesses, and promoting a quick return to their regular living environment are key factors to their successful treatment. Stays at Bridgeway range from a night to a few weeks.
But Alvin, he's never been around after I got better. He's in the nursing home, enjoying himself. So it's easy for me, even though I'm living alone now. I can do pretty much what I want to, when I want to. Made me 25 years younger because I am going to aerobic classes, water classes, so I've got myself a bathing suit. Can you guess? I went down the water slide 2 times. What a thrill.
More often than not, depression is misdiagnosed or overlooked. The problem magnifies among older adults, leaving them feel as though it's just part of aging or an existing medical condition. But your doctor can only treat you if you say how you are really feeling.
Even younger ages, if you have a medical problem and your medication isn't doing right for you, I would recommend highly to go to the Bridgeway unit in Fergus Falls.
If you're interested in learning more about Bridgeway Care Unit, talk with your physician or call Lake Region Healthcare Corporation in Fergus Falls.